Good afternoon, everybody. I'm Dr. Josh Renkens, and today we wanted to talk to you about hip mobility, the importance of it, and then I'm going to demonstrate a simple strategy that you can do anywhere to hopefully improve upon your hip mobility. So the importance of it lies in the fact that your hip is sort of the master key, I guess, to your whole core. So when people talk about core, a lot of times they're in reference to their abdominal area, but really your core encompasses, from your thigh through your pelvic region up into your abdomen, the oblique system, your low back, even up as far as like the lats. So, and I would say of all that stuff that I just listed on the way up the chain here, the hips are sort of the master of that core region. So, mobility and the importance of it. If one doesn't have hip mobility, they leave themselves very, very vulnerable to everything from low back pain to knee problems, to of course problems in the hip or SI joint area, or perhaps even in the groin area. All that stuff can come from a lack of motion or a lack of mobility at the hip. And today what I wanted to talk to you about, in the past we've demonstrated hip flexion, we've demonstrated hip extension and how to improve upon it. Today I wanted to demonstrate a little bit about the rotational aspect of the hip. So with that being said, I'm going to get into what has become commonly known as the 90-90 position. So I've got a 90-degree angle here at the front knee, I've got 90 degrees here, and then I've got 90 degrees there. So I guess it could be called 90-90-90, but a lot of people just call it 90-90. So what I'm going to do is I'm going to walk you through what to kind of look for, feel for, and how to approach this. So first what I would do is I'd get into the position, and I'm demonstrating here with my left side forward and my right leg back. So in this instance, I've got my left hip and femur externally rotated, and I've got my right hip femur internally rotated. So of course you want to do this on both sides. So when it comes time to change sides, you can just simply swivel that way, or of course you can kind of change hips this way. So because you're going to get a different benefit, and we're going to go over that today, of how to attack both internal and external. So first things first, get into your position, and you want to try to keep your back nice and neutral. So what you don't want to do is try to get closer and closer and closer to the floor where you're rounding your spine. One, it may not be the best position for your spine, and then secondly, you're sort of leaving the hip off the hook, so to speak. So we want to put as much good stress and good tension and good stimulus, put some good stuff into the hip as we can. So keep your back neutral. First thing I would do is I would aim my sternum toward my knee. And you can notice I'm sort of leading with my chest, kind of keeping my eyes here on the horizon, and just kind of feel that, see what it feels like, and then change and go sternum toward the mid-shin. Same thing. See what you feel in that hip, and then last but not least, you can go sternum toward the foot and ankle, and go forward and see what that feels like. You got flexibility to check other things. I just wanted to give you a couple ideas on three main points. You can turn yourself further this way, or you can turn yourself further this way. But I would start with these first three. So knee, mid-shin, foot, and ankle. If one of those three feels more tension in this, the outside of this hip, or you might feel it in the groin area, or you might feel it on the other side of your body, or you may feel it in the small of your lower back. Whatever position you feel some tension in, I would encourage you to just hang out in that position. So let's say I kind of scour through these different positions, and I notice that I feel more tension in my left hip when my sternum is aimed toward the middle of my leg. So what I can do is just hang out here and sort of refine my breath, use my breath, and begin to breathe deeply. And just use my breath and sort of gravity itself to help that hip release a little bit. If I feel comfortable doing so, I can kind of close down this angle a little bit. But notice again, I'm keeping my back in a nice, safe, effective position. And I would hang out there for a minute to maybe 2 minutes. okay? And then you can switch and check the right side. After you've done that, you can employ a couple other effective strategies for this hip that's in external rotation. So let's keep the same point where I'm focused on sort of sternum to mid-shin. What I can do is I can establish some tension, and then I can add what has become known as either a contract-relax method, or I can use a pale rail, which is an FRC concept, which is genius, and it's a great system for all you people out there. So what I can do therefore is I can contract the muscles in my hip by pushing my knee, lower leg, foot, and ankle down into the floor, such as so. So I'm doing this with my left leg, and of course that's coming from my hip. So I'm going to push down into the floor while I keep my torso constant. This angle remains constant, and I push and I slowly ramp up the intensity. So I start at, say, a 1 out of 10, and I keep pushing, 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 and by the time I get to about 10 seconds, I'm pushing, 8, 9, 10 level of intensity, and then I stop pushing, and then what I do is I try to close down this angle. So essentially keeping my back straight, I'm going to bring my chest closer and closer and closer until I reach a point where I can no longer go further comfortably, okay? That's 1 rep. So now from this position, I maintain this torso angle, and I can begin the next contraction. So again, I'm going to push my knee, lower leg, foot, ankle down into the floor. Torso remains constant. Push, I'm ramping it up, ramping it up, ramping it up. And then I relax, stop pushing, and then try to close down the angle yet again. Get closer and closer and closer. And then I could repeat that for as many reps as you want. Now, more advanced protocols would be you push down, and then upon sort of closing down this angle here, in addition to closing down the angle, I can try to actively lift my lower leg, ankle, and foot at the same time and really close down that angle like that. So, but for starters, I would just start kind of with that first process, okay? So that would take care of the externally rotated side. So what you could do then is switch to the right side and do the same protocol, with the right leg forward. Now for this back side, this one is internally rotated, remember. So if I sit up tall and I simply rotate my torso toward my right knee, thigh, leg, foot, I'm essentially, my torso is going right, my right hip femur is essentially internally rotating even more relative to my torso. So even doing this is a good strategy to improve internal rotation. And then I can return back to center, and I can rotate again, come back to center. So you could do that for, let's say anywhere from 3 to 5 repetitions. Another strategy that I'll use, and I'll sort of coach some patients on this, is we'll do what are called lift-offs, or end-range lift-offs. So say I get in my position, and I've got my torso centered over my pelvis here. I can begin by simply lifting my foot and ankle off the ground. And when I do that, you can see my femur, my hip, is rotating more internally. Okay? So a couple fun strategies that you can play with here. One is I can simply lift off. 2, I could push my foot and ankle down into the floor to contract, and then slowly ramp up that intensity as we spoke of before. And then at the end of that contraction, I can lift off to get more internal rotation. The last strategy you could use is you could take something, any object you might have, and I can go here and I can do my rep And then wherever I end up, I can place an object, underneath that newfound range, and then I can contract again and try to lift off from there. And then if I've got a friend or a training partner, they can put something else under there at that height, and then I can try to lift off from that, okay? So that's a good little strategy. And then the last thing you can do is, while in this position, you can try to lift not only the foot and ankle, but you can try to lift the right knee too. So if I get in my position, I can try to lift off, hold, and then back down. And then if I want to add that contraction, I can push down, so knee, lower leg, ankle, foot, push that down into the floor, ramp up the intensity so that when I get to that sort of 10-second mark, I'm pushing near maximal intensity, and then I can lift off from there. And you notice when I lift off, I'm not shifting my body around in a compensatory type of way. So if you find yourself doing that, then the joint isn't, or the tissue around the joint and the joint isn't really ready for that level of intensity. So I hope you found this useful. If you have any questions, I'd love to help you out. And I hope to see you next time. Thank you.